Welcome back for our weekly live interview with San Luis Obispo County leaders, and today we're talking vaccines.
And Dr. Penny Bornstein, County Health Director, joins us live via Zoom. Good afternoon to you. We are heading into the cold and flu season. We want to start with the new COVID-19 vaccine. What are your recommendations?
My recommendation is that this vaccine is the thing that's going to keep you well through the fall and winter and well into next year. It's not so much a new vaccine. It is based on the vaccine we've had around for almost 3 years. So it's been incredibly safety tested, probably more so than any other vaccine in history of mankind. And it is tailored to the target vaccine strains that we're seeing circulating right now.
And we're hearing it's going to be available in the fall and soon. Do we have any specific idea about when people will be able to get it and how they'll be able to get it?
Yes, individuals can start getting it now in certain places. We hear in community pharmacies. Some of them have already received their doses. We at Public Health haven't. We don't know about other doctors' offices, but people should call around and see if they can get it at this time.
And one thing that people seem to forget when we're having discussions that this virus, that this is changing. Mm-hmm. The virus that creates COVID-19 is always changing. So for people who perhaps didn't, for whatever reason, get this before, what's your message to them?
So this is like influenza. We get a new vaccine every year because the viral strains change. COVID is very much like that. So you want to keep up to date. Even if you haven't gotten it before, get it now, and it'll protect you against particularly hospitalizations and even deaths. That's been the most important aspect of this vaccine, is it has led to the real decrease in those horrible outcomes of this virus.
And what's the expectation for this year's flu season and the recommended vaccine for this particular strain? I believe we've heard before it's okay to get the flu vaccine and the COVID vaccine at the same time.
Yes, you definitely can get these two together. We don't know what our flu season is going to look like. It hasn't started yet. In the southern hemisphere, it was not so terrible, so we hope that the same is true. But vaccines are your best protection against circulating respiratory viruses, be it flu, be it COVID. RSV is also now available for vaccine for certain populations. So I highly recommend that people take advantage of these protective medications, vaccinations that are available to them. It's available for age 6 months and up with COVID and flu. And for the most part, you just have to get one dose and you're done this year. For some of the younger children, they may get additional doses in smaller numbers.
Okay, so again, for babies as young as 6 months.
Yeah.
Okay. Dr. Penny Bornstein, thank you so much for taking time out of your afternoon.